Hey everyone, Dr. Charlie Johnson, physical therapist. Today I want to talk to you a little bit about the SI joint, okay? So we're going to talk about what it is, where it's located, the common types of people we see this occur in, and some signs to help you determine perhaps if you have SI joint pain or problems, okay? So the first thing, SI joint pain occurs in about 15 to 30% at the most of people who believe that they have lower back pain, all right? So not super common, but again, up to about 30%. This on the right here is a picture of the pelvis. Here's the pelvis, here's the tailbone. These are the bones of the lower back, and here are the legs. And this is a view as if you were looking from the back to the front of a person. So kind of take my pelvis from this position and put it on up there. Highlighted in red here are the SI joints. So the SI joints, there are actually two of them, one on either side of the pelvis. And the best way to think about the SI joints is as a stress relieving joint. Okay, so the SI joint is a stress relieving joint. It allows us for shock absorption and allows us to kind of accommodate for the forces that come up from the ground when we're walking and or moving, and down from the lower back when we're bending, lifting, or twisting. So everything kind of centers in the pelvis and allows the pelvis to become sort of a flexible ring. So that's really where the SI joints are and their purpose as stress relieving joints. Okay? Now, SI joint problems most commonly occur in three types of people. Young and active folks. When you're young, you have a pretty flexible pelvis. The bones aren't fully hardened, and the pelvis often moves fairly well. So the issue that we see here is that the pelvis can often move too well. Okay, so we often see young females, specifically gymnastics, cheerleading, have SI joint problems. We see, young runners. So if you're running, you step in a pothole or you step off a curb, or just the repetitive kind of impact of the ground coming up through the legs into the pelvis can cause an SI joint problem. Okay, or if you're just walking on outside, it's a winter day, you slip and you fall on one of your buttocks, that can also cause a problem in the pelvis. The second group of people we see this occur in are those who are going through pregnancy or even up to a year, maybe a little bit more after pregnancy, okay? Why? Because during pregnancy, a hormone is secreted to allow the pelvis to relax, which allows the pelvis to become very flexible in order for childbirth to occur. And again, this allows the pelvis to move and often move excessively, so this can cause a problem. The third group of people are older folks, specifically with lower back surgeries or low back fusions in particular. So older folks, while the pelvis is usually more rigid and solidified, what we see is that, if you remember, the SI joint is a stress relieving joint. So when you fuse the low back or stabilize it with rods, the motion from above doesn't have anywhere to go. So the pelvis has to move excessively, and it can cause problems within the pelvis, specifically in the SI joint. Okay, so there's the three groups of people we see this occur in. Now you might be wondering, what are some of the signs of it? I'm going to help you out with that. Okay, so you might have SI joint pain. If you have pain that is one-sided. So SI joint pain, while it can occur on both sides of the pelvis, is almost always on one side. You have tenderness to touch right near the area of the SI joint. So if you take your hand and kind of form a little bit of a C shape, and you put your thumb below the level of the belt line, on one side you'll notice a little bit of a bony bump. That is right around the area of the SI joint. And often people with SI joint problems will have pretty significant tenderness and or just say, hey, that's right where my pain is, okay? So if you have one-sided pain and you have tenderness to that area, and you have pain below the level of the belt line, okay? So it's one-sided pain. You're saying, yes, Charlie, I have pain that's on the right side and is right in that area. It's tender and it's below the belt line, okay? And hopefully you can read this. You have pain getting out of a chair or going from a sitting to standing position, and maybe, although not always, you have some groin pain. So I'll put a question mark again, not always, but the SI joint can kind of have the tendency to wrap around the front, usually not right on the side of the hip, but maybe you feel something in the groin, or again, definitely in this area. So this might be the primary area where you feel it, right at that one kind of thumb point, but it may wrap around a little bit. So those are some of the signs of the SI joint, or that you may have an SI joint problem. If you're watching this and you think you might have an SI joint problem after hearing what I've had to say, and you want to learn a little bit more or just share your story, email me at charliejohnsondpt@gmail.com. I'd love to hear from you. So thanks so much. Hopefully this helps you out.